This pandemic is nowhere near over, and with the incredible growth of Omicron globally, new variants are likely to emerge.
A stark warning from the World Health Organization as new infections continue to rise around the world. Hello, I'm Nathan King, sitting in for Anna Naidu, and this is The Heat. Hello again. According to the World Health Organization, new COVID-19 infections have increased by 20% globally after the past week alone, with more than 18 million cases reported. But there is some positive news. Omicron infections appear to be peaking in some countries. Here in the United States, new cases are dropping in a growing number of places, while rising in some others. CGTN's Jim Spellman has more in this report.
The Omicron variant now accounts for 99.5% of COVID-19 cases in the U.S. and a growing percentage of cases globally. Though Omicron is often less deadly and often causes less serious illness, especially in those fully vaccinated, the sheer numbers are overwhelming hospitals.
Omicron continues to sweep the world. Last week, there were more than 18 million reported cases. The number of deaths remains stable for the moment, but we're concerned about the impact Omicron is having on already exhausted health workers and overburdened health systems.
The World Health Organization is particularly concerned about countries with low vaccination rates. The WHO's Strategic Advisory Group of Experts on Immunizations meets Wednesday. They're focused on boosting vaccination rates in poorer countries. In the U.S., data suggests the Omicron variant-driven surge may have peaked in New York City and other parts of the northeastern U.S., but the worst may be yet to come for other parts of the nation.
The challenge is that the entire country is not moving at the same pace. The Omicron wave started later in other parts of the country, so we shouldn't expect a national peak in the next coming days. Next few weeks will be tough.
A website to register for free COVID-19 rapid tests in the U.S. is up and running. Each household can order 4 tests that will be shipped to them by the U.S. Postal Service in the coming weeks.
We have 1 billion tests that will become available to people that they can order through the website.
New guidance from the CDC suggests N95 and KN95 masks are more effective than cloth masks, but stops short of clearly recommending a switch to those masks, acknowledging some people will only wear what is comfortable.
Well, I understand it's a good protection, but still, it's difficult to breathe in them.
The Biden administration says it will distribute 400 million free N95 masks like this one at local pharmacies and public health centers. The White House hopes to have the program up and running by early February. Jim Spellman, CGTN, Bethesda, Maryland.
Well, there's a lot to talk about. Let's get straight to our panel. Arthur Dong is professor at Georgetown University School of Business. Also with us is Gavin Macgregor-Skinner. He's Senior Director of the Global Biorisk Advisory Council and an infectious disease expert. And with us also is William Haseltine. He's the Chair and President of Access Health International and author of Variants, the Shape-Shifting Challenge of COVID-19 Vaccine Evasion and Reinfection. Thank you all very much for joining us. First of all, let's start with you, William. We heard the warning there from the WHO about rising number of cases, but in some countries, including Western Europe and potentially the US, there seems to be a bit of a silver lining when it comes to the cloud of COVID and the Omicron variant.
The United States, of course, is a big country, and we've seen before the waves are not uniform. Yeah. In some parts, where I am in New England, it seems to be beginning to decline after a very sharp rise, much higher than we had before. But that doesn't mean it's over in the United States altogether. Surgeon General made that point. The idea that this is a mild infection is not correct for those people who are not vaccinated, and it's even not correct for people who are fully vaccinated but who have difficulties, who are at high risk. They may be very old, over, say, 75. They may have immunosuppressed situations, or for the very young. We're seeing an extraordinary number of young people, very young people, entering the hospital, some vaccinated, some not. So it's a much more complicated picture than we would like it to be, but that's the way it is. Complicated in terms of spread and complicated in terms of impact. Certainly our hospitals, as you noted earlier, are overwhelmed. We're running about 3,000 deaths a day, which is about the peak we've ever been at. So it's tough for us.
Gavin, I want to bring you in here and play you a short soundbite of Boris Johnson, the British Prime Minister, because he's decided to lift the COVID restrictions just imposed around the Christmas break, remove the so-called Plan B. And I want to get your reaction after the end of this. Let's have a listen.
From now on, the government is no longer asking people to work from home. And people should now speak to their employers about arrangements for returning to the office. And having looked at the data carefully, the Cabinet concluded that once regulations lapse, the government will no longer mandate the wearing of face masks anywhere. In the country at large, we will continue to suggest the use of face coverings in enclosed or crowded spaces, particularly when you come into contact with people you don't normally meet, but we will trust the judgment of the British people and no longer criminalise anyone who chooses not to wear one.
Now, Gavin, that's the British Prime Minister there announcing lift. Now, he has political problems, so it might be that he wants a little boost in the polls. But from the UK to the United States, from Austria to Australia, you're seeing very different reactions on this. Is this lack of a sort of cohesiveness when it comes to global public policy going to encourage more variants? Should we all be moving in the same direction at the same time in a way?
It's really interesting that that let it rip attitude right now is something that I don't support, many of my colleagues don't support. We know for other infectious diseases we would never say let it rip. And this is what we're hearing in many different countries right now from politicians. If people don't adhere to getting vaccinated, don't adhere to getting boosted, again, it doesn't increase those levels of population immunity. You don't bring in the basic, really easy, low-cost, fundamental ways of protecting yourself and others from getting infected, then we're not going to reach endemic situation. We're going to have again still increased numbers down at that local level, like William mentioned, and we're going to see more hospitalizations, more deaths. And I want to be really clear on the current course that I'm seeing the politicians take us, and the way that some of the population is dealing with this COVID-19 disease and virus right now. It's going to continue to take us on that pathway of new variants. Some of those variants won't affect us. Our immunity will be able to protect us, but there could be another variant out there. We had Delta, and we thought Delta was it. We thought Delta was going to end the pandemic. Then we went to Omicron. We don't know what comes next. And at the moment, this reckless political jargon and decisions we're saying at the moment is going to take us down a pathway of disaster.
Well, Gavin, that's strong words. Joining us now is Chris Smith, and people who are friends of this show know he's a consulting virologist at the University of Cambridge and co-presenter of the Naked Scientist podcast. Luckily for us, he's fully dressed right now. We heard from Boris Johnson just there, and I'd just like you to pick up on Gavin's point here, because if you compare, say, the United Kingdom and France, one's let it rip, as Gavin said, more laissez-faire, and the other is sort of a war against the unvaccinated. That's just a difference of 30 kilometres or so. So what is this unbalanced global approach doing for the future of this virus?
Well, in the UK, it's actually timely to be reducing restrictions because the rates of virus are falling. And at peak, a few weeks back, we were seeing 250,000 diagnoses per day. Now, we were testing very hard. We were doing 1.8 million tests per day. It's the highest per capita test rate of many countries in the entire world. So unsurprisingly, we were finding a lot of cases. But what we were also finding is those cases were not carrying consequences the way that previous variants had, like Delta, for example. We were not seeing that translation of caseload into a hospital burden or worse. And this is most obvious when you look at the number of people who are on ventilators, for example. We're actually seeing fewer people now on ventilators in hospital compared with before Omicron actually arrived on our shores. So
you're saying,
really
sorry to interrupt, so you're saying it's not a political decision here, often it's just the different amounts of virus left in different countries?
I think in the UK at the moment, actually, it's a reaction and an appropriate one to changing circumstances. We've got falling caseload of virus. We've got a very highly vaccinated population. Our data show 96% of our population have got antibodies against the coronavirus. We're not going to get much better than that by continuing to flog the message of vaccines. We know that there will always be a few people who are a bit resistant to wanting to get vaccinated, but we've done very, very well. So therefore, one argument is, well, if not now, when? When will we be adequately prepared to reopen up our country? And so that's really why they are withdrawing from many of these restrictions, because actually the evidence is that they are not actually saving any lives anymore, because we're not translating those cases into consequences in hospital. This is, in our vaccinated population, a much milder illness.
I want to bring in Arthur Dong here, because obviously the growth of the coronavirus usually means not so much growth for the global economy, but all these countries are dealing with it very differently and having very different economic outlooks. I mean, if you look at China with its sort of so-called zero COVID policy, its numbers were pretty good for the latest quarter, although obviously there's some consumer spending worries. If you look at the US, a different policy, but still a strong economy. What's going on? It seems to be one policy doesn't necessarily mean one economic outlook.
Yes, Nathan, I dare say that we are living in a COVID situation and a COVID global economy. Even though we're starting to see the restoration of economic activity, particularly in the world's developed markets, such as the EU and the United States, by far, there are portions of the world that are still suffering from the economic consequences of COVID-related, downturns in their economy. All the major economies in the world are under pressure right now. And until we get to a point where we can find a way to collectively provide some solutions, particularly to those emerging market nations, in terms of suppressing COVID, I dare say that we're in for a rough time economically for the next 12 to 24 months.
I want to go back to William on that point, because I want to play all of you a soundbite from the WHO, because there is this warning that some countries have had less than 10% of their populations vaccinated. Large countries, in Africa, 1%. Let's have a listen, and I want to get your reaction off the back. William.
Most of the people in the hospital, any country you take or any city, are unvaccinated. So let's just remember that we have very good vaccines now, and we need to use them. We need to vaccinate more people for whatever reason they haven't been vaccinated. Many people, even in countries where there are supplies, there are huge gaps in those populations as well. And of course, there are many countries in the world which do not have supplies, which is what COVAX has been set up to try to bridge.
Well, William, where are those vaccines? Because there was a big push in the last couple of months from a lot of developed countries to try and send out vaccines or make them more available. China and Russia, of course, were doing the same thing. But they just aren't having the penetration rates that they're meant to, right?
Well, COVAX has been a disappointment, but it's beginning to take hold. They now have about 1 billion vaccines in hand and that have been donated by the donor countries. They need more than that, obviously. But I think we need to take a lesson from this, which is it's very important for the international finance organizations to do their best to help build the infrastructures for long-term vaccine manufacturing all over the world, modern vaccine manufacturing plants. So as we need more vaccines for COVID and other disasters that are very likely to befall us, we will have them. I'd say something else about the relaxing of restrictions and the variability of that. You know, Britain, I just checked, had 90,000 cases, higher than they've ever had before. I'm not so sure that in the midst of 90,000 cases for a small country like Britain, that should be the number where people begin to relax. They had about 450 deaths. That is not a number that they should be comfortable with. And I don't think it was the right thing to do at this time. That doesn't mean never, but those people who say, if not now, when, I think have to really think about why not now when there are 90,000 people being recorded as being infected every day. Same thing in the United States. We have these same pressures, but the numbers are astronomical here. 1 million people being infected on a daily basis is truly astounding. And that's just the ones we're counting. So I think we've got to be careful with this. And you brought up the point earlier. The more people are infected in the world, the more variants are going to arise. And we cannot predict what those variants will be, just as we could not predict Omicron. Omicron came out of nowhere.
Exactly.
It just doesn't look like anything we've seen. So that's what can happen. Thanks a lot.
Well, Gavin, let's bring you in here because Omicron, of course, was very quickly detected in South Africa. A lot of amazing work done there by scientists. Ended up being punished for it with travel bans, etc. Is it just weeks away from, we hear, I can't remember what the next letter of the Greek alphabet is going to be, but the next variant, and what lessons can be applied now that we've learned from Delta and Omicron?
Yeah, who would have thought, Nathan, we'd have to go back to high school and learn our Greek alphabet again?
Exactly, right.
Did. No, the point right now is we need to slow things down. I work in lots of hospitals here on the East Coast of the US. I travel every week. I was traveling to Los Angeles last week for work. I actually run safety programs in hospitals. 3 of my flights were cancelled last week because the airlines told me the staff were absent from work because they were sick with COVID-19.
Yeah.
And so we really have to slow things down. So again, we're seeing cancellations everywhere. We had a big storm here on the East Coast, a snowstorm over the weekend. I know all the airports, the hotels that I'm talking at the moment are all really low on staff at the moment. And if you wanted to see this for yourself, Nathan, I do a lot of work with the federal government. If you look at the Transportation Security Administration website, that's the TSA.gov website.
Yeah.
Today, TSA has listed 3,456 employees have active COVID-19 infections. Those individuals are staying at home. They're not at work. The strain that puts on safety, security in our airports is enormous. And that's happening right now.
Yeah, Arthur, the economic impact of this has also been seen from supply chains to squeezing demand, increased demand and squeeze on staff, as Gavin so eloquently put it there. That's helped fuel inflation too. And this is a real worry, isn't it? As people try to get back to sort of a COVID normality, the economies are going to be very, very difficult to put any more stimulus in if we get another shock through COVID, correct?
Certainly, Nathan. The things that you point to are all sort of the headline issues that are creating challenges in the global economy. Inflation, labor market concentration, labor market compression in terms of, there isn't a day that goes by when you don't pick up the newspaper and you read about some company, some industry that is suffering to an extent, labor challenges and the inability to get their hands on workers. And this is certainly going to be exacerbated by the fact that COVID is still present and you have very large numbers of the working population sitting at home because they are quarantined as a result of COVID. So the challenges that the global economy are facing are many. I'm keeping a close watch on these inflation numbers. That's not only just sort of being demonstrated and exhibited here in the United States, but certainly being demonstrated in all parts of the world. You see commodity price increases with regard to the food supply and food chain, and that certainly hurts those at the bottom of the pyramid because they spend a disproportionate amount of their income on basic necessities such as food. And I'm keeping also a very close watch on energy. Current geopolitical tensions are increasing pressures on supply. And should war break out in Ukraine, it's going to be a different game. We already saw in the last 12 months the price of oil go from $45 a barrel, now residing at about $90 a barrel, or almost doubling in price. All of that's reflected throughout ripples across the entire global economy, because whether it's food, construction, airplanes, transportation, delivery of goods, all those costs are going up. And as a result, creating greater pressure on national economies at a time when these national economies have less and less in terms of policy tools to deal with, these inflationary impacts.
Chris, I want to go back to you because in the UK you've seen that balancing act, haven't you, very much between sort of the economy and what's going on. And I think Arthur came up with a really good point as did Gavin, about the staff being stretched. I have a skin in this game. My sister's a NHS doctor in London, and she's pretty knackered right now. And there's a lot of people not turning up for work. Are you worried that if what you're saying was a good time to lift restrictions may lead to even more of a strain on healthcare workers and the economy generally as people get this virus?
You're right that there's been a lot of pressure on our ability to deliver our services. The NHS, the health service, is one of those services, but education is suffering as well. We had perhaps 10% of teachers not in front of classes at one point because they were isolating. It doesn't mean those people were severely ill, they were just off work. Now, some people did get a more severe illness, some people were quite unwell, but most weren't unwell at all. And actually, we're in a situation where the pill is in many circumstances worse than the ill. We are paralysing the ability to run a country because of these isolation rules. And that's prompted another change on the part of the government in terms of policy, because the period of isolation, which was required to be 10 days, if you had the infection, you would isolate for 10 days. That initially was stepped down to 6 or 7 days. It's now 5 days, as long as you've had 2 clear tests on the day 5 and 6, you can head off again. So they're trying to address that. But yes, we're in a situation where we're effectively causing ourselves problems, shooting ourselves in the foot because of fairly draconian measures to try to control this virus. I'd like to deal with a couple of other misconceptions, if I may.
Sure, quickly. I want to get on to William, but carry on quickly.
Well, I was going to point out that everyone says we need to vaccinate the world because that will stop variants. Now, I don't dispute that we need to vaccinate the world because we need to stop severe disease. But we won't stop variants because these vaccines don't stop you getting infected. And in countries with very low caseload, like South Africa, that's where Omicron was born, with just a handful of cases per day, while countries like the UK were having 250,000 cases per day. So it's not just number. It actually matters where it's happening, and it's stopping severe disease that should be our priority, not trying to stop variants and immunise the entire world. Because as Andrew Pollard from Oxford University pointed out a couple of weeks ago, and he helped to invent the AstraZeneca vaccine, we cannot vaccinate the entire world population multiple times per year to keep up with variants.
William, do you want to just pick up on that?
Yeah, the first point I'd make is Alpha came from Britain. Alpha did come from the UK, not from South Africa. We're talking now about Omicron, and we don't know where it came from. It was first seen actually.
We do have a pretty good idea where it came from. It came from Southern Africa, probably Botswana, possibly South Africa.
William, can you address the idea of not vaccinating everyone because you can't, was that point, but also the fact that variants will come anyway, and vaccines don't necessarily stop you getting infected, but actually stop you getting ill?
That the previous speaker is entirely correct, that we can't stop the variants from coming. We can't predict what their nature will be. And as a matter of fact, as he's pointed out, we're not exactly sure where they come from. Do they come from immunosuppressed, 1 or 2 immunosuppressed patients? Possibly. Do they come from a combination with a household rat or mouse or some other animal? Maybe. Or do they just come from, let's say, we really don't know. And we don't know that for influenza either. But we do know that they are very frequent. If we follow the example of influenza, they'll keep coming no matter how much we are vaccinated. And some of them, as is the case for flu, might be a lot worse than others. So this is something we have to take seriously. Now, the reason to vaccinate most of the world is because the vaccines, many of the better vaccines, seem to prevent people from becoming ill. We don't know for how long that will hold. It doesn't hold for all vaccines for all time, but at least we're very fortunate. If you're thoroughly vaccinated, perhaps 3 doses of the Pfizer, the Moderna vaccines, or the AstraZeneca vaccine, with 2 doses, you may be protected for a year, 2 years, 3 years from serious disease. We should be, and I don't know why people are so averse to this notion. We are used to vaccinating for influenza every year. That's not a terrible thing. It's not a terrible burden for most people.
Well,
It doesn't happen all over the world, but it is a standard practice, and I think it's maybe a standard practice for COVID.
So I want to move on to Gavin, because Moderna, as you know, are thinking of actually combining a flu vaccine and a COVID vaccine next year, which took me as a fantastic idea if they can pull it off. Are we now dumping this whole idea of testing, tracing, isolating globally to try and then move on to basically treating this like we would flu as it becomes endemic, or are we not there yet?
No, we're on that pathway, Nathan. It's really, for me, professionally, it's disappointing. I started to get involved in COVID-19 back in January 2020 when I went to Hong Kong and saw the first Hong Kong patients and learnt more about this disease. But it was never our desire for this virus to become endemic. Unfortunately, it looks like it will. We haven't finished doing the comparisons with flu. That's incomplete. But right now, what we're seeing, say, in the state of Vermont, which last year in 2021 had the country's highest vaccination rate, still had a lot of COVID-19 cases, but they had 3 times the death rate they had in Vermont from COVID-19 compared to flu. We really don't want this disease to become endemic, because at the local level, at the city level, the state level where we're doing the studies, it's signs of it being endemic. It's not good. It's not. And even if we had an endemic virus that was about 80% of what Delta was, that would still lead to a lot of absenteeisms. 2022 is going to be the year for I was absent at work. I'm pretty sure of that. And we're focused so much at the moment on hospitalizations and death rates. It's more about whether people can actually function normal in their normal capacity. And that's what Omicron does. It takes you out for a week or maybe even 2 weeks.
Yeah. Arthur, final word to you, because what does that world look like in 2022? You get a week or 2 off work, your teachers may not be in school, etc., etc. Are we all going to struggle emotionally, socially, but also economically, of course?
Yeah, certainly would agree with Gavin and William's remarks that this is going to create continued stress within the United States economy and worldwide. A higher amount of fatigue is going to continue to persist amongst individuals and families who are dealing with these kinds of COVID-related disruptions to their lives, the inability for schools to resume normalcy. These are all causing tensions within the economic landscape of the United States. So I dare say, again, 2022, we're not out of the woods yet.
Well, thanks so much, Arthur. I just want to thank all our guests, because it's really rare that I turn on the television these days and you have an intelligent, science-based discussion about COVID without it going off the rails. And I really learn something whenever you guys are on, so I really appreciate it. So, Arthur, Chris, William, Gavin, I really appreciate you being here. And unfortunately, that's all we have time for this edition of The Heat. I'm Nathan King in Washington, D.C. Thanks for watching. Hope to see you soon.